Hello, good morning. So today we are going to discuss about the spine examination. Spine examination में सबसे पहले name, age, sex, and all demographic data we have to take. After that, complaint. What complaint patients have in spine examination? You can say, for example, patient have pain, swelling, all that. So you have to drill the pen in great detail. So for drilling pen, what you have to tell in the great detail is what is the site of the pen, or what is the onset. For example, whether it is sudden onset or it is a insidious onset. So onset, after that onset is progression, whether it is gradual progressive or fast progressive. Okay. So progression, after that progression, you have to tell about uh, whether relieving and aggravating factor. So whether pain is relieving or on the rest, or aggravating on the walking, or bending forward, or whether it is relieving on bending forward, or whether it is aggravating or bending forward. For example, in case of lumbar disc prolapse, it is aggravate. Pain is aggravating on the bending forward, and in case of lumbar canal stenosis, it is relieving on bending forward. So that we have to tell. Then aggravating, after aggravating relieving factor, then you have to tell about that uh, severity of pain. So, in case of severity of pain, we have to tell uh, what type analgesics patient taking, or how much analgesic is taken, whether it's taking frequently and the analgesic, or is uh, or what dose he taking. Okay, and analgesics. Okay, type of analgesics. What analgesic he taking. Then whether the pain is affecting his day-to-day activity, daily life activities, or whether it's the pain is affecting his sleep or not. That also should be mentioned. Okay, then after that. Also, I forgot to tell about radiation. Radiation pain is very important. Radiation, whether the pain is radiating to your limbs or not, whether it is in case of cervical problems, cervical spine problems, it's radiating the upper limb, lumbar, or sacral, it is radiated to lower limb. So, whether the pain is radiating or not, okay, that is important. Okay, mainly it's radiating the condition like lumbar disc prolapse, or whether it is your uh, any tuberculosis also, and or maybe your uh, lumbar canal stenosis. Okay, all these conditions may radiate to your limbs. Okay, so these is the after that you have to tell about rule out the getting points for like fever and weight loss, and or immunized temperature in case of tuberculosis, and weight loss of appetite and weight loss in case of your any tumors of the any malignant type of tumor of your spine. Okay, so these are the main things you have to tell in the history detail. Okay, then after that we direct jump to the examination. In case of examinations, you have to again I am standing here, or from standing from the examination from front. In case of in inspection from the front, see the position of the head, shoulder. Okay, whether the shoulder drooping or not. And in case of your lumbar disc prolapse, it's maybe or in case of scoliosis, the shoulder may one shoulder may droop one side. Okay, and so from the again from the side, again you have to see your sagittal balance, and your kyphosis also can be seen from the side. Okay, so Then back is the main thing. So, from back we are going to examine proper examination from point. Okay, so from back, condition of skin or any redness, any scar, any dilated veins, or okay, on inspection. Okay, scar, dilated veins, or in condition of skin, any redness, any swelling or not. So all these points can be noted in from back. And also look the spine, your midline, any deviation of the midline. Okay, your that is David in case of your scoliosis. Okay, and see any prominence of the paraspinal muscle or any wasting of the paraspinal muscles can be seen from the back. So prominence is mainly seen in case of your any pain conditions like lumbar disc prolapse or any your your any condition like your ankylosing spondylitis or like this condition. Okay, then uh, whether it is whether your position of your dimple of Venus PSIs, and of course you have to see any your plumb lines is from midlines, any division that plumb line. Okay, plumb line have to be seen. And then see any tuft of hair or any uh, capitulus spots, tuft of hair, or your posterior hairlines also should be seen. Okay, or capitulus spots for the neurofibroma, and tuft of hair and your low posterior lines also can be indicate some other conditions. Okay, so these points are main points in the inspection. In case of palpation, you have to palpate the spine. Like for suppose this is spine, you have to palpate from top to the bottom, and you can do the gentle thrust also. Okay, palpate the PSIs also. Okay, uh, for the sacroiliac joint pathology. So in palpation also can be there any steps or not. Okay, also inspection you have to see any steps. Okay, so palpation any steps or not, that can be palpate. Then any paraspinal muscle, your prominence can be palpated. Okay, so these are the main points in the inspection and sorry palpation. Then after that we go to the neurological examinations. Okay, so neurological examinations, upper limb. First of all, what are the points on the neurological examination? First of all, on tone, you have to see tone, then sensory examination, then your motor examination, and then reflexes. Okay, so first of all, you have to see the tone of the muscles can be seen. Okay, okay, then after that uh, sensory examination of upper limb. So your C5 is correspond to the deltoid. Okay, this is your C5. C6, this is your anatomical position. Okay, C6 is your outside of your and your thumb and your thumb and the forearm, and C7 is your middle finger. C8 is your side of your little finger and your forearm. C8 is your side of your medial epicondyle. Okay, so these are the sensation you have to check. And then motor examination, just abduct your shoulder and see the power of deltoid. Okay, just against resistance. Then for your this is for C5. Then C6, just see the wrist extension. C6, C7, just see the extension of elbow against resistance. Extension of elbow. C7. Then C8 is just you see the grip in C8, and T1 is just spreading the fingers. So this is the examination of limb. And all, of course reflexes should check, look for reflex. Using hammers, keep your thumb on the bicep tendon, so you see the biceps reflex. Okay. Triceps likewise. Okay. Triceps supinator or brachioradius, all that these reflexes should be seen. After that lower limb examinations. In lower limb, your L1 is your upper thigh, L2 is mid thigh, L3 is in front of the knee, L3 is front of knee, L4 is your medial side of the leg, L5 is outer side of the leg, then S1 is your side of your sole. S1 is side of sole. So how to do the motor examination of this? This is for the look for power of these muscles. So for L2, just your hip uh, hip flexion against resistance L2, hip flexion against resistance is L2. L3 is your knee knee extension against resistance. Okay, knee extension against resistance, knee extension against resistance L3. L4 is just your um, again dorsiflexion of your ankle against resistance is L4. L5 is just your EHL. Okay, L5 for EHL, that your flexion of your dorsiflexion of your big toe against resistance, that is L5. S1 is just compressing the something. Okay, like you're doing you compress your brake pedal like that. Okay, then you compressing like that, that is S1. So we can do these exams likewise also, that this is your just flexing the hip, that is your L2. This is your L3, just sit and stand, that is your knee extension, that is L3. L4 is just your stand your on your heels, that is L4. L5 is just L5 is just your do your Tendelbach test like that. Okay, stand in the one limb that is going to test, that is L5 or Tendelbach. Then S1 is just stand your on your toes, that is S1. Okay, so these are the, then of course you have to see your knee reflex, ankle reflex. Okay, all that. So these are the main neurological examinations. So after that neurological examination, we can see the some conditions. Okay, so first of all, we are see that cervical spondylitis. So in case of cervical spondylitis, uh, what do we look in the cervical spondylitis? What are the symptoms? There will be neck pain and heaviness in the shoulder and your deltoid region, and maybe the weakness of your upper limb or tingling numbness, all that. For the one test is for your cervical spondylitis, that is your Sperling test. What is Sperling test? Spelling test is nothing but you have to. Sorry, I forgot to tell the movements. First, you have to go to movements. Okay, so movements and okay, movements is just nothing but you for the your cervical spine. This is your flexion. Okay, this is your extension. Okay, this is your lateral flexion. Okay, this is your lateral flexion, and this is your rotation, side by side rotation. Okay, so these and for your lumbar spine, that is your flexion. Okay, in during flexion also sober test also can be done in the flexion position. Sober test is nothing but it is when you are flexing, uh, join the uh, two PSIs by the line. Okay, you use pencil and join the two PSIs or dimple of penis. Join that and then take a measurement of 10 centimeter above that. Mark that point. Then ask the patient to the bend down and take measurement. If it is coming 15 centimeter or more than 15, that is normal. If it's coming less than 15 centimeter, that is abnormal. That is said to be some restriction due to the some uh, condition of some pain, uh, pathology due to your lumbar disc prolapse or any other pathology that can be tell it is a restriction. Okay, patient not bending due to the some pain or whatever. Okay, that is so much test. Then your that is your flexion. Then your extension, like this, your extension, your spine, lumbar spine. Then lateral flexion. This is your lateral flexion. Also, it is giving indicate some pain during your flex. For example, this side you have lumbar disc prolapse, so you are bending this side, your pain will be there. Okay, so these are your main movements of the your spine. Then okay, then comes to the some individual conditions like first of all cervical spondylitis. Cervical spondylitis is a pain in your neck, heaviness on the shoulder, maybe the weakness or tingling numbness of your upper limbs. And in the Sperling test, one test is Sperling test. Just extend and just lateral flexion of your that side you have pain and see the pain is aggravating or symptoms aggravating or not. Then you have to can give compression some to see the aggravation of symptoms and also distraction test. Ask the patient to lie down and just distract the neck, extend and distract, and that is relieving his symptoms. That is distraction test. Okay. Other than that, this is your I already described that that is your lumbar disc prolapse. Lumbar disc prolapse. I think I did mistake in the last video. That is your Lesigo test. Lesigo test is just do your SLR and SLR typically come to 30 to 60 degree range. Okay, if there is pain and you when the pain get relieved and then you just do compression on the your foot, do possible dorsiflexion of your foot to stress the nerve. So that is your Lesigo test. Then other than that is Boston test. Boston test is just again do SLR and just take your his lower limb to your arm and then you just flex the his knee and see the relief of symptoms. Then just you keep your finger in the popliteal fossa and just stress that there from the nerve. That see that they will go like string. They will be there. So that is Boston test also for the your lumbar disc prolapse. Other than that, your cross leg SLR is also there. You suppose you raised one leg and then pain in the opposite. That is your cross leg SLR, and then these are the main thing in your BIVD. Then your cervical myelopathy also there. Cervical myelopathy is your symptoms of your neck pain and your occipital headaches and of course your tingling numbness, all that can be there, and weakness of your entrenching. So you cannot do your fine movements, buttoning, unbuttoning. That is uh, difficult to do. Okay, your fine work difficult to do in the cervical myelopathy. Okay, and patient is not able to walk properly. What is the gait in the cervical myelopathy? Gait, he will walk wider gait. Okay, in cervical myelopathy, is walking with wider gait. Okay, okay, he is not able to walk properly. Okay, he will walk with a wider gait. Okay, then also in the your PIOD, he will walk with the high stepping gait. Okay, high stepping gait in the PIOD, because there is a weakness of your dorsiflexor of your ankle, all that. So he will in PIOD he will walk with a high step gait, high stepping gait. So these are the main things. Your myelopathy. Uh, your in myelopathy you can do your Romberg test. Okay, Romberg is just take both lower limbs closer and stand like this and close your eyes. Okay, and if you tend to sway, that is your positive Romberg test. Of course, your do your uh, other test also, that it can be a conflict positive in the okay in the cervical myelopathy. So these are the main things. So this is the your main examination points in the spine. Uh, I think spine examination is much difficult for me. Uh, I may have made many mistakes. I know. So yeah, so that's for all today. Some remaining points we take some other video. So that's all for this video. Okay.